Very much, Presiding Officer. This time last year, there were 648 patients in Scotland's NHS who had waited more than 2 years for treatment. First Minister, how many people are now enduring this long wait?
First Minister.
There are more people now waiting for NHS treatment. That will be the case for those waiting the longest period of time, including over a year and over 2 years. That is why our NHS recovery plan is so important, which is to improve waiting times generally, but also to ensure that health boards are targeting those who are waiting longest. As we know, indeed, as the Health Secretary has just been narrating to the Chamber, before the pandemic, we were seeing progress in reducing waiting times, given the pressures at that time that were on the National Health Service. The pandemic obviously had a significant impact, but in terms of the statistics published most recently, we are starting to see tentative signs of improvement as a result of the actions that we are seeing. So in the most recent quarter, for example, we saw an increasing number of first outpatient appointments and we saw a slight reduction in those waiting over 12 weeks. Similarly, with the treatment time guarantee, we saw an increasing number of patients seen. So this is challenging for the National Health Service. It can't be otherwise, given the impact of a 2-year pandemic, which is still making its presence felt. But the Government is supporting health boards to ensure that that recovery happens, and as part of that, that those waiting the longest for treatment are seen as quickly as possible.
Douglas Ross.
The question was straightforward. There were 648 patients last year waiting longer than 2 years for treatment. What is it now? The answer the First Minister couldn't or wouldn't give is 10,613 people in Scotland who have waited more than 2 years for treatment in our NHS. The First Minister was speaking about tentative improvements. That is a 16-fold increase in a year. This isn't the NHS recovery her government promised. Things are getting worse, far worse, not better, First Minister. Now we're hearing of heart patients being given appointments 2 years down the line. Reports today state people are receiving appointment dates in July 2024. First Minister, is that acceptable?
First Minister.
In terms of the particular case cited in the media today, no, I don't think that is acceptable, and I know that a review of that particular appointment, which is a follow-up outpatient appointment, not a first outpatient appointment, is being undertaken, and contact with the patient will be made. It is the case that waiting times generally, and those waiting an unacceptably long time for treatment, has increased over the past year. I'm afraid that is the impact of a global pandemic. We have, over the past year, seen further waves of COVID that has had a big impact on the number of treatments that can be done in our National Health Service, as infection control measures have had to be tightened up, and of course as a number of staff have themselves had COVID and been off sick. That is an impact that countries across the UK, countries across Europe and the world are finding themselves at the moment. That is why we are investing so heavily. We have record numbers of staff working in our National Health Service, up considerably just in the last year, and up by almost 30,000 since this government took office. And it's why we are investing specifically in the recovery plan. And while these are tentative signs, it is encouraging that we are starting to see some of the improvements that I narrated in my earlier answer. And while I am responsible, as is the Health Secretary in the Government, for NHS Scotland, it is the case that in very challenging circumstances, whether we look at A&E or waiting times more generally, we see through the efforts of staff in NHS Scotland the work that is being done. So, for example, in Scotland, per 1,000 of the population, there are 101 patients waiting. These are the most recent statistics. In England, that's 112 per 1,000, and in Wales, 221. That doesn't excuse the performance in Scotland. We have a responsibility to tackle that, and that is exactly what we are doing.
Douglas Ross.
The First Minister says things are encouraging. How encouraging must it be for that heart patient to get a letter telling her to wait another 2 years to be seen. And as expected, the First Minister speaks about the pandemic. I have a constituent in Lossey who has been waiting 4.5 years from first being seen by his doctor to getting the operation he needs. 4.5 years is far longer than the pandemic. In fact, it's pretty much an entire parliamentary term. And the longer and longer waiting times are a problem across every area of Scotland's NHS. Twice as many Scots are waiting over 3 months for key diagnostic tests compared to last year. This morning, the President of the Royal College of Radiology, Jeanette Dixon, said for every 4-week delay to diagnosis of cancer, your risk of dying increases by 10%. First Minister, these are her words. So people are deteriorating. Cancers are growing. Sometimes they're becoming incurable. More often, patients are having to have more devastating treatment. Treatment with bigger side effects that has a bigger impact on their quality of life for the same outcome. First Minister, if our NHS is currently in this position, how bad is it going to be by winter when so many more people need treatment? And will you act now instead of waiting for the crisis to strike like you did last year?
First Minister.
That's not what we did last year. What happened last year is that we had further waves of the COVID pandemic, similar to countries across the world. And of course, I'm going to mention the pandemic. There is not a health service literally on the face of the planet that has not had to deal with the impacts of a pandemic. And I think anybody looking at this reasonably understands that. Before the pandemic, we were seeing progress. So, for example, before the pandemic, the number of outpatients waiting for a first appointment had reduced by more than 20%. Over the same period, the numbers waiting over 12 weeks had fallen by more than 30%. We were seeing an increase in the number of inpatient and day case treatments carried out. The pandemic clearly had an impact. At the start of the pandemic, we paused all but the most urgent treatments on the National Health Service. So the health service here, as in other countries, is having to recover and catch up. And that is what it is doing. And we are starting to see some tentative signs of progress, and we will continue to support the National Health Service. On the Royal College of Radiologists report, which is an important piece of work, let me first of all set some context, Presiding Officer, because this is important. Since this government took office, there has been a 95% increase in the consultant oncologist workforce. There has been a 63% increase in the consultant radiologist workforce. As the report acknowledges, recruitment within these professions is challenging, nationally and globally, made more challenging by Brexit, it has to be said. But we're working with health boards on new approaches to maximise the capacity. And as the Royal College report also says, the increasing use of imaging networks in Scotland is going from strength to strength. So these are challenges that are inescapable given what we've lived through in these past 2 years. But this government continues to get on with supporting the National Health Service to recover and to deliver for patients.
Douglas Ross.
The First Minister doesn't like opposition politicians stating that the COVID pandemic can't be blamed for everything. Therefore, will she listen to the President of the Royal College of Radiology, Jeanette Dixon, this morning again said this: "It's not the pandemic that has caused the shortage. The pandemic has laid bare the shortages that were there before. It's also exacerbated the shortage as well because of diagnostic backlogs." That is from clinicians who are speaking to the government right now, saying don't use these excuses. It is clearly problems that have been built up for years and years. Now, last winter, we saw the NHS battle from crisis to crisis. Our ambulance service and A&E department struggled so much with patient demand that our United Kingdom Armed Forces had to step in. This year, we're not even close to winter, and the situation is far worse. Scottish patients are being sent to England for treatment that they can't get here. Well, the First Minister looks puzzled. We've spoken to Alan Turner, a 70-year-old from Kelso. He was referred for knee replacement in October. He was told he would have to wait up to 3 years to get that knee replacement on the NHS in Scotland. Or he could go to England for private treatment paid by Scotland's NHS. He reluctantly agreed to travel south, and he was successfully operated on. Then When he returned to Scotland, he tried to get essential aftercare and physiotherapy locally, and he was told he couldn't for months. Alan is now back to square one. He can't even bend his knee. He'll need to endure the painful wait for treatment all over again. So while it's welcome that we can rely on services across our United Kingdom in times of need, First Minister, should people like Alan really need to go to England for treatment in the first place?
First Minister.
Obviously, I'm happy to look into individual cases, but in general terms, that's a mischaracterisation of the position. And I point out to Douglas Ross again that while I don't shy away from the challenges in NHS Scotland, which are my responsibility, waiting times are worse in England than they are in Scotland. Accident and emergency waiting times are worse in England than they are in Scotland. Our accident and emergency departments that were mentioned by Douglas Ross are the best performing anywhere in the UK, although performance needs to improve. But let me come to the specific point that Douglas Ross, this was not somebody, certainly from the information that Douglas Ross has shared, I'm happy to look at any more information that is available. When someone is waiting on the NHS and are waiting too long for treatment, if it is possible for NHS Scotland, at NHS Scotland expense, to access treatment in the independent sector, it will do that in the interests of the patient. Sometimes, and there are agreements in place between Scotland and other parts of the UK for more specialist treatment, and they work in both directions. But in terms of standard, this patient, from what Douglas Ross has said, hasn't gone to NHS England for treatment. We have paid for treatment in the independent sector, so they are treated more quickly than they would be otherwise. That is what happens while we continue to invest in the improvement of waiting times on NHS Scotland. So we will continue to address these challenges, we will continue to invest, we will continue to support record numbers of staff in our National Health Service and get on with that job.